A word to the wise: graft. Human tissue that's transplanted between people or from one part of a person to another. Also, the surgery in which this transplant is performed.
A shotgun blast 5 years ago blew this woman's face to pieces, a 46-year-old mother of two. In a moment, her identity gone. This was the end result. Connie Culp no longer had a nose, could not eat solids or drink from a cup. She had a hard time breathing. She lived in virtual seclusion.
Little children would shy away from her and actually be scared of her.
Then after years of waiting, Culp was matched with a donor, a face donor. Even as a doctor, I'd never seen anything quite like it. The most extensive facial transplant ever. Before, after. It took 22 hours, 8 surgeons. 80% of Culp's face, her palate, upper lip, nose, eyelids, replaced with that of a donor. And here's how she got it. First, graft skin from the face of a donor who had just died. Doctors careful to preserve arteries, veins, nerves. The next hours are critical. Using powerful microscope, doctors married the veins and arteries from donor to recipient and then grafted the donor's skin onto Culp's face. The only indication it worked, the veins and arteries began to course with blood.
You have to wait and see if it clots or make sure that it continues to flush. For that initial 5 minutes is you know you've done your job.
Face transplantation is new territory, conferring tremendous risk, especially for a procedure that, unlike liver or heart transplantation, is not life-saving. Add to that, face transplant patients require high doses of immune system suppressing drugs for life, so that the body does not reject the new face.